Well, here is some good news from the medical world. The U.S. Food and Drug Administration have recently approved a new therapy for the treatment of certain types of prostate cancer. Here's the medical director from the Tulane Cancer Center with the latest on this promising new treatment, along with a clinical trial patient who's received the therapy.
Hi, I'm Dr. Oliver Sarter. I'm medical director of the Tulane Cancer Center. I'd like to talk a little bit about Pluvicto, this new FDA-approved treatment. It's a molecularly targeted radiation, and it depends on the presence of something called PSMA, or prostate-specific membrane antigen, on the surface of prostate cancer cells. And by the way, we can detect that with imaging with something called a PSMA PET. The molecularly targeted radiation will bind to PSMA and then deliver this radiation into the tumor and the surrounding microenvironment. And the end result is a prolongation of survival, and that's why the FDA approved the drug. It's for very specific patients, and I want to recommend that this is looked at carefully because not everybody with prostate cancer is going to be eligible. You end up having to have metastatic castrate-resistant prostate cancer that is PSMA PET positive on a scan, and you've already progressed after initial hormonal therapy, novel hormones, and a taxane-based chemotherapy, so it's not for everybody. But listen, I want to introduce Van LaCour, who's a patient who participated in the trial and who's received the therapy. Van, I wonder if you might tell us a little bit about your experiences.
Thank you. I'd be happy to share my story and my experience. I was originally diagnosed with prostate cancer in 2007 and elected to have the surgery because the prostate was enlarged and it was hard. So I had the surgery, removed the cancer out of my body, was cancer-free for like 8 years. In 2015, it reappeared and metastasized itself to my bones and became prostate cancer in my bones. Went through several treatments of chemo with different oncologists. It was not driving the PSA down enough, but it did drive it down some. So eventually I was referred to Dr. Sarter, and then who was running the clinical studies programs, and he accepted me into his program. And it got to a point where he offered me the Pluvicto, which was pretty much being successfully tested and what have you. But I got the medicine and it worked.
Well, Van, thank you for sharing your story. And Pluvicto, there's more information, of course. Pluvicto.com is a website where you can get more information on it. It's given one injection every 6 weeks for a total of up to 6 doses. And again, FDA approved March 23rd, 2022. And that's important news for patients with advanced prostate cancer. Thank you very much.